Hi, I'm Dr. Patrick Abbey with the Maxillofacial Surgery Center in Tampa, Florida. And this will be a short explanation about dental implants. Simply put, they provide for a permanent replacement for either a missing tooth or multiple missing teeth. The dental implant itself is actually just a titanium replacement for the root structure of a natural tooth. This is placed into the bone of the upper or the lower jaw and provides the foundation for a general dentist to then build upon. They will typically provide for a lifelong replacement for either situation. Dental implants have been around for over 30 years. And in the past 10 years, innovation in design and technique have skyrocketed with an over 95% success rate. They are rapidly becoming an everyday procedure across the country and the standard of care for replacement of missing teeth. Usually the first questions our patients have is, how much will this hurt? Both me and my wallet. Our patients will typically feel as if the implant placement itself is 10 times easier for both the surgery and the recovery than having a simple tooth extraction, with most being back to normal activity the day after the procedure is completed. As for the costs, they are rapidly becoming much more affordable as well and are closer now to the same cost as a dental 3-unit bridge, which was the older standard method for restoring for a missing tooth. We have found over the past 20 years that the biggest key to success in implant placement is in appropriate treatment planning. With modern advancements, there are very few patients today that would not be able to have implant placed via different techniques and ways that we have of being able to augment it. This requires state-of-the-art diagnosis and planning to be able to accomplish. We were the first surgery office in Tampa to acquire an in-office CAT scanner that was able to help with this phase of treatment planning. This allows us to get a low cost and very low radiation 3-dimensional view of the jaw structure that previously was only available in terms of cost in the thousands of dollars and having to be obtained in a hospital setting. The jawbone is a complex curved structure and is impossible to predictably view with simple old-fashioned 2-dimensional x-rays. The CAT scan allows us to do virtual treatment planning and to see structures such as nerves and sinus cavities to limit the potential for complications. I will have already done your surgery on the computer before we ever actually get to the stage of having a patient in the chair to start with something with the dental implants. The procedure typically involves 2 stages, with the placement of the implant or the root replacement being done in the jaw first. This will usually take a few months to heal, and that happens a little faster in the lower jaw because of the bone being much more dense than in the upper jaw. Once the implant is healed, or what we term integrated within the bone, then the tooth or the teeth are ready to be connected to the implant. There's an interim part, which is also known as an abutment, that connects between the implant, which is in the bone, and through the gum tissue to the tooth or the teeth that are then placed on top of it for the patient to function with. This is typically coordinated between the general dentist and our office, as the final part of the restoration is accomplished with the general dentist. We strongly believe in the need for great total communication between the general dentist and our office throughout the treatment course, as this is vital to an optimal outcome. Once completed, whether it's with single teeth or multiple missing teeth, the restoration is typically one that can't be distinguished from either the existing teeth around it or noticed as an artificial tooth replacement as compared to a denture or some other prosthetic options there are. Also, the implants allow for great anchorage of the prosthetic or the single individual tooth that's put back, and the patient's able to return to normal function. These are probably, in my practice, the happiest patients we have on the backside of their treatment, as oftentimes the changes from what they've been dealing with in a space or a gap or missing all of their teeth to be able to get back to really a completely normal bite and occlusal function for them is just a great joy and awesome to watch. So hopefully this has given you a nice overview of dental implants, and certainly we can answer any other further questions upon visiting our office. Thank you.